If your blood pressure looks highest first thing in the morning, even when you think you are doing everything right, what I'm about to show you may completely change how you read those numbers. Because for many seniors, that early reading is not random. It is a clue. Sometimes it is a clue that your body is under hidden strain while you sleep. Sometimes it is a clue that your medication is fading too early. And sometimes it is a clue that the number on your monitor is being pushed up by a mistake so small you would never think it mattered. I'm Dr. William Elliott, so please subscribe for clear, life-saving health videos that help you stay informed, protected, and independent. Now here is the part that worries me. Morning blood pressure is not just another blood pressure reading. The early hours of the day are when the body is shifting from rest to activity. Hormones rise, the nervous system wakes up, blood vessels tighten, the heart begins to work harder. That means a pressure that seems only a little high at 7 a.m. can be telling a much bigger story than the same number at 3 p.m. And if you are a senior, that story matters even more because aging arteries are less forgiving. Over the years, I have met so many older adults who told me the same thing. Doctor, my pressure is fine later, but every morning it shoots up. Some were frightened, some were frustrated, some thought the monitor was broken, some assumed it was just nerves. But when we looked closely, there were patterns hiding in plain sight. 7 of them, to be exact. 7 hidden reasons that can push morning blood pressure higher and keep it there. By the end of this video, you will know what those 7 reasons are, how to recognize them, and which one is the most dangerous to ignore. But before I show you reason number 7, I need you to understand something essential. Not every morning rise is automatically a medical emergency. Blood pressure normally begins climbing a few hours before you wake up. That is part of human biology. The danger begins when that rise becomes exaggerated, repeated, or connected to another problem, like poor sleep, uncontrolled hypertension, medication gaps, or heavy strain on the heart and blood vessels. So stay with me, because the difference between a normal rise and a dangerous pattern could change what happens at your next doctor's visit. Let's start with hidden reason number 7, because it fools people every single day, and it has nothing to do with disease. It has to do with what you do in the first 5 minutes after you wake up. Those first minutes are a biological transition zone, and that is why they are so easy to misunderstand. Your body is shifting from lying flat to sitting or standing. Blood pressure is adjusting to gravity. Your muscles are beginning to work. Even your breathing pattern changes. Seniors often assume that if the clock says morning, the number must represent some pure, untouched baseline. It usually does not. The first number of the day is often the most vulnerable to being distorted by routine, posture, and timing, which is exactly why so many people get frightened by readings that are not telling the full truth. I want to tell you about Leonard. Leonard was 76, careful, disciplined, and proud of how consistent he was with his health routine. Every morning he woke at 6:15, got out of bed, shuffled to the kitchen, fed the cat, turned on the lights, walked back to the bedroom, sat on the bed, wrapped the cuff around his arm, and checked his blood pressure. Same time, same monitor, same arm, same routine. And yet his readings were always high in the morning, often 20 points higher than what we saw later in the day. Leonard thought something inside his body was going wrong at sunrise. It was not. The problem was that he was not measuring resting blood pressure. He was measuring moving around the house blood pressure. Those first few minutes after getting up matter more than most people realize. The moment you stand, your body shifts blood flow to keep you upright. Your nervous system activates. Your heart rate changes. If you walk, bend, lift, hurry, talk, or even feel rushed, the number on the monitor can rise before you ever sit down. That is hidden reason number 7. You are checking too soon after activity. And for seniors, that little burst of early movement can create a much bigger spike than it would in a younger person. So if you want to know your true morning pressure, do this instead. Wake up, use the bathroom if needed, then sit quietly with your back supported, your feet flat, and your arm at heart level for at least 5 full minutes. No phone, no conversation, no television, no rushing, just stillness. Leonard changed only that one habit, and his dangerous morning pressure dropped by nearly 15 points. What makes this so tricky is that the rise feels earned. You got up, you walked a little, you did not run a mile. So the brain says that tiny bit of movement should not matter. But blood pressure is incredibly sensitive to transitions. Standing from bed, climbing one short staircase, searching for your glasses, hurrying because the cuff is taking too long. All of that can nudge the nervous system upward. If your heart and blood vessels are already dealing with age, stiffness, or chronic hypertension, that nudge becomes a shove. The monitor records the shove, and you assume it is your true baseline. But here is where people get caught. They think, I only walked a few steps. That can't matter. Oh, it can. And hidden reason number 6 is even more deceptive because it feels harmless, ordinary, and completely unrelated to blood pressure. Your bladder. Let me tell you about Patricia. Patricia was 71 and had become deeply anxious about her morning numbers. She kept her monitor on the nightstand and checked her pressure almost the second she opened her eyes. Convenient, right? Except every morning she was waking up with a full bladder. Her readings were consistently high, 158 over 92, 162 over 94, 160 over 90. She was convinced her medication had stopped working. What Patricia did not know is that a full bladder can push blood pressure upward. When the bladder is distended, the body responds with increased sympathetic activity. In plain English, the nerves that help regulate blood vessel tone and body tension become more activated. That means tighter blood vessels and higher pressure. On top of that, Patricia was slightly uncomfortable, slightly tense, and slightly impatient while the cuff inflated. Each of those little signals added to the number. Hidden reason number 6 is measuring with a full bladder, or measuring while your body is already uncomfortable and on alert. Seniors do this all the time because morning seems like the purest moment to check. But the best moment is not the earliest moment. The best moment is the first truly calm moment. After Patricia emptied her bladder and rested before measuring, her readings fell back into a range that matched her office measurements. She did not need a new drug. She needed a different sequence. And let me add one more layer here, because this is where people accidentally stack errors. Many seniors wake up, feel the urge to urinate, notice they are thirsty, feel a little chilly, and start worrying about what the number will be before they even sit down. That is discomfort, tension, and anticipation all at once. Then the cuff begins to squeeze, and the body gets even more alert. None of that creates a reliable resting reading. It creates a reading contaminated by urgency. Patricia was not sick at sunrise. She was measuring in the middle of a small physiological alarm. If this sounds familiar, keep going, because hidden reason number 5 has nothing to do with technique. It is built into the body itself. Hidden reason number 5 is the natural morning blood pressure surge. This is where many people become confused, because they hear that blood pressure is higher in the morning and assume something must be wrong. Not necessarily. Your body was never designed to stay in night mode after sunrise. As waking approaches, stress hormones begin to rise. Cortisol rises. Adrenaline activity increases. The sympathetic nervous system becomes more active. Blood vessels tighten. The heart prepares to deliver more blood to muscles and organs because the body is getting ready to stand, walk, think, react, and move through the day. That normal transition creates what doctors call the morning surge. And in a healthy system, it is expected. But here is the problem. In seniors, the surge can become stronger because arteries are often stiffer than they used to be. Blood vessels do not expand as easily. The buffering system is weaker. So the same hormonal wake-up signal that causes a modest rise in a younger adult can create a sharper jump in someone older. Add long-standing hypertension, diabetes, smoking history, or vascular stiffness, and the morning rise can become much more pronounced. I saw this clearly in a patient named Harold. Harold was 79, active, and convinced that his body was betraying him at dawn. His pressure at 2 p.m. might be 128 over 76. At 7 a.m., it was often 150 over 88. Nothing about his routine seemed obviously wrong. He was resting correctly. He was using a proper cuff. He was logging readings carefully. So what was happening? What was happening was physiology. Harold's early morning hormone surge was real, and his aging arteries were amplifying it. Once we understood that pattern, we stopped reacting to single numbers and started looking at the whole day, the whole week, and the overall trend. That distinction matters, because when the morning surge is expected and moderate, you observe it. When it is excessive, frequent, or linked with other risk factors, you investigate it. Harold did not need panic. He needed interpretation. There is another twist to this, especially for seniors who wake stiff, sore, or cold. The body does not experience morning in a vacuum. If the bedroom is chilly, blood vessels can constrict more. If arthritis pain hits the moment your feet touch the floor, stress signals rise faster. If you dread the day ahead, the mind joins the surge. So the natural morning increase is not always a single wave. Sometimes it is several waves arriving together. That is why older adults can feel as if their pressure jumps out of nowhere, when in reality a whole cluster of sunrise triggers is piling on at once. But interpretation alone is not enough when the next hidden reason is involved. Because hidden reason number 4 can quietly raise blood pressure night after night and leave you wondering why every morning feels like a bad report card. Hidden reason number 4 is poor sleep. I am not just talking about lying awake all night. I am talking about fragmented sleep, short sleep, restless sleep, pain-interrupted sleep, bathroom trips every hour, or the kind of light, thin sleep that never truly restores the nervous system. During healthy sleep, blood pressure normally dips. That nighttime dip gives the heart and blood vessels a chance to recover. But when sleep is too short or too broken, that recovery is reduced. The body stays in a more activated state, and the next morning can begin at a higher pressure baseline. This happened to Marilyn, age 68. Marilyn told me her pressure was mysteriously high every morning, yet she swore nothing in her diet or medication had changed. Then I asked one simple question: "How are you sleeping?" She laughed and said, "Terribly." Her arthritis pain woke her several times a night. She tossed, turned, checked the clock, worried about not sleeping, then finally got up already exhausted. In other words, her body never really got the calm nighttime reset it needed. Poor sleep raises the tension of the entire system. You wake with more stress hormone activity, more irritability, more fatigue, and often more pain sensitivity. Then you sit down and check your blood pressure, and the monitor captures the aftermath. Marilyn's story reminds us that the blood pressure number you see at sunrise may actually be a sleep number in disguise. Once her nighttime pain management improved and her sleep became more continuous, her morning pressures improved as well. I want you to think about that carefully, because many seniors separate sleep from blood pressure as if they belong to different worlds. They do not. If you wake every 2 hours, if you stare at the ceiling, if you ache, if you worry, if you never reach deep restorative sleep, your cardiovascular system feels that all night long. The morning monitor is simply the messenger. Do not blame the messenger without asking what happened between bedtime and breakfast. Now listen carefully, because hidden reason number 3 is where morning hypertension stops being merely frustrating and starts becoming a major medical clue. Hidden reason number 3 is sleep apnea. If there is one issue seniors overlook again and again, it is this one. They think sleep apnea only happens to loud snorers, to people who are severely overweight, or to men who fall asleep in recliners. That is far too narrow. Sleep apnea can show up in many forms. Yes, snoring is common. Yes, gasping and choking during sleep can happen. But sometimes the clues are quieter. Waking unrefreshed, morning headaches, dry mouth, frequent nighttime urination, daytime fatigue, concentration problems, or blood pressure that is stubbornly high when you first wake up. Let me tell you about Raymond. Raymond was 74 and had what his wife called heroic snoring. He brushed it off for years. But his morning blood pressure was persistently high, even though he took medication faithfully. He would wake up tired, heavy-headed, and irritable. His readings at 6:30 a.m. were often in the 160s. By late afternoon, they were lower. That pattern went on for months. A sleep study finally revealed severe obstructive sleep apnea. Every time his airway narrowed during sleep, oxygen dropped, the brain sensed danger, and the body reacted with stress signals. Blood vessels tightened, heart strain increased, blood pressure surged. Then it happened again, and again, and again. By morning, his cardiovascular system had spent the entire night being shoved into repeated mini emergencies. That is why sleep apnea matters so much. It does not just disturb sleep, it can drive blood pressure upward during the night and leave it elevated when you wake. In some people, it also contributes to blood pressure that becomes hard to control even with multiple medications. Raymond started treatment, and over time, his morning numbers became far more stable. Not perfect overnight, but better. And the fatigue he blamed on aging began to lift. And here is the heartbreaking part. Many families normalize the warning signs for years. They joke about the snoring. They joke about the naps. They joke about the morning headaches. They call it old age, or they call it just how he sleeps. Meanwhile, the body is repeatedly losing airflow, losing oxygen, and firing off emergency signals through the night. So if morning hypertension is showing up again and again, especially alongside those clues, sleep apnea should move much higher on the list of possibilities. So if your morning blood pressure is high again and again, and you also snore, wake with headaches, feel unusually sleepy, or your partner says you stop breathing at night, do not dismiss that. It may be the clue that explains the whole picture. But sleep apnea is not the whole story. Hidden reason number 2 affects seniors who take their pills faithfully and still get surprising morning numbers. Hidden reason number 2 is that your medication coverage may not be lasting through the night. This is a delicate subject, so let me be very precise. I am not telling you to change when you take your blood pressure medicine on your own. Do not do that. Medication timing is individual. What I am telling you is that if your readings are consistently highest in the morning, one possibility is that your current regimen is not covering the last part of the night well enough. Some people are on doses that are too weak. Some are on combinations that do not last long enough. Some occasionally miss doses. Some take a medication at a time that fits poorly with their pattern. And some have morning surges that their current plan simply does not control. Elaine taught me this lesson years ago. Elaine was 73, responsible, organized, and very proud that she never forgot her medications. Her afternoon readings were respectable. Her evening readings were respectable. But every morning, they rose before breakfast like clockwork. She assumed that meant her pressure was just naturally bad in the morning. But when we reviewed her medication profile, one of her medicines was simply not giving full, round-the-clock coverage. The problem was not her willpower. The problem was the treatment design. After her physician adjusted the regimen, her early readings became much more consistent. Notice what I did not say. I did not say everyone should move pills to bedtime. Research does not support one universal timing rule for all patients. What matters is control, safety, side effects, and adherence. The right lesson is not take it later. The right lesson is, if your mornings are always worst, that pattern deserves a medication review. This is also where honesty matters, because sometimes the issue is not the medicine itself, but the real-life routine around it. Maybe doses are taken at different times on different days. Maybe one pill causes bathroom trips and you quietly skip it before appointments. Maybe you forget a refill and stretch tablets longer than you should. Maybe you split pills unevenly. None of that makes you careless. It makes you human. But your doctor can only solve a morning blood pressure pattern if the true routine is on the table. And now we arrive at hidden reason number 1, the one that surprises the most people because it usually happens the night before the reading, long before the cuff ever touches your arm. Hidden reason number 1 is what you ate and drank in the evening. This is the reason families miss constantly. A senior will wake up with a pressure of 162/90 and assume the morning itself caused it. But often the setup began at dinner, a salty restaurant meal, canned soup, deli meat, frozen entrees, pizza, Chinese takeout, crackers, cheese, and processed snacks in front of the television, a couple of drinks to unwind. Maybe not outrageous choices, just ordinary choices repeated often enough to matter. Sodium pulls fluid into the circulation. More fluid in the system can mean more pressure pushing against blood vessel walls. Alcohol can complicate that picture further, especially with heavier use or when it disrupts sleep. And if a salty dinner is followed by poor sleep, nighttime thirst, bathroom trips, and a rushed early measurement, the morning number can end up looking dramatically worse. I remember Josephine, 70, who insisted her blood pressure had a mind of its own. During the week, her readings were mixed. On Sunday mornings, though, they were reliably higher. Why Sunday? After enough discussion, the pattern appeared. Saturday night was family dinner: ham, bread, cheese, olives, sauces, dessert, and a couple of glasses of wine. Great evening. Sunday morning spike? Absolutely. When Josephine reduced the salt load, drank more wisely, and paid attention to what happened after restaurant meals and holiday foods, her random spikes stopped feeling random. This is why I tell seniors not to judge blood pressure in isolation. Every number has a backstory. Sometimes the backstory is hidden in last night's menu. Restaurant food is especially sneaky here, because the meal may not taste shockingly salty and still contain an enormous sodium load. The same is true of canned soups, packaged sauces, cured meats, frozen dinners, and those little evening snacks people barely count because they seem so small. Your body counts them. Your blood vessels count them. And if you are sensitive to sodium, the morning after can expose that sensitivity with a number that looks sudden, even though the setup began 12 hours earlier. Now that you know the 7 reasons, I want to step back and show you how they connect, because this is where everything becomes useful. Morning blood pressure is not one problem. It is a pattern created by layers. You might have a normal hormone surge plus poor sleep, or mild sleep apnea plus a full bladder plus a salty dinner, or stiff arteries plus a medication gap, or no medical problem at all, just a rush technique that falsely convinces you something terrible is happening. That is why guessing is dangerous. Guessing leads to fear. Guessing leads to overchecking. Guessing leads some people to take extra medication they were never told to take. And guessing can hide the real reason your mornings keep looking bad. So what should you do if your pressure is always high first thing in the morning? Let me give you a practical protocol. First, make sure you are measuring correctly. Empty your bladder. Sit quietly for 5 minutes. Keep your feet flat on the floor and your arms supported at heart level. Do not talk. Do not watch the news. Do not measure while uncomfortable, cold, angry, or in a hurry. Take 2 readings, 1 minute apart, and record both. Second, do this consistently for at least 1 week. One scary reading proves almost nothing. A pattern proves something. Write down the time, the numbers, whether you slept poorly, whether you snored or woke with a headache, whether dinner was especially salty, whether you drank alcohol, and whether you took your medication as prescribed. Those notes are pure gold when your doctor is trying to understand what is going on. I cannot overstate this. A clean logbook can shorten the path to the right answer dramatically. It helps your clinician separate normal variation from a true morning pattern. It helps reveal whether sleep may be involved. It helps show whether evenings are setting up mornings. And it prevents the most common problem of all, trying to reconstruct weeks of blood pressure history from memory, fear, and rough guesses. Real numbers taken the same way are more useful than dramatic numbers remembered imperfectly. Third, compare morning readings with later readings. If your pressure is only high in the morning, that suggests one kind of pattern. If it is high all day, that suggests another. If it is wildly different every morning, technique or sleep quality may be playing a bigger role than you think. Patterns tell the story. Isolated numbers mostly tell you fear. Fourth, pay attention to sleep clues. Snoring, choking awake, morning headaches, dry mouth, daytime sleepiness, needing multiple naps, or blood pressure that remains stubborn despite medication should all raise the question of sleep apnea. Seniors miss this diagnosis all the time because they think tiredness is just part of getting older. It is not always age. Sometimes it is oxygen deprivation happening night after night. Fifth, never adjust medication on your own because of one high morning number. I need to say that clearly. Do not double a dose. Do not add an old pill from the medicine cabinet. Do not take a neighbor's advice. Bring a log to your clinician. If your morning pressure is repeatedly elevated, your treatment may need adjustment, but that decision should be made with real data and professional guidance. And there is one more thing I need to tell you, because every blood pressure conversation should include it. If you ever have a very high reading along with chest pain, severe shortness of breath, new confusion, sudden weakness, trouble speaking, or vision changes, that is not a YouTube problem. That is an emergency situation, and you need immediate medical attention. Before we finish, let me tell you about Walter, because Walter's story brings all 7 reasons together better than any list ever could. Walter was 78 and convinced his body was falling apart only in the mornings. Every dawn, the same story. High pressure, heavy head, frustration. He measured the instant he came back from the bathroom, usually after shuffling around the house and grumbling about the cold. He slept poorly because of shoulder pain. He snored like a chainsaw, according to his wife. He loved canned soup and salty crackers at night, and although he took his medicine faithfully, his regimen had never been reviewed in years. In other words, Walter did not have one hidden reason. He had 5 of them stacked on top of each other. We changed the process first. Quiet rest before measuring. Proper seated position. Repeat readings. Then we addressed pain and sleep. Then his doctor reviewed the medication plan. Then he cut back the high-sodium evening foods. Later, a sleep evaluation confirmed apnea. The result was not magic. It was not instant. But it was powerful. Within weeks, the chaos in his logbook began to settle. Within months, the morning dread was gone, because the numbers finally made sense. That is what I want for you. Not perfection, not obsession, clarity. Because once you understand why your blood pressure is high every morning, you stop reacting blindly to the monitor. You stop assuming the worst. You stop missing the clues your body is giving you. Maybe your numbers are being pushed up by technique. Maybe they are pointing toward poor sleep. Maybe they are signaling sleep apnea. Maybe your medication needs a fresh look. Maybe last night's salt and alcohol are leaving a fingerprint at sunrise. The good news is that each of those possibilities can be investigated, and many can be improved. So here is the bottom line. A high morning blood pressure reading is never something to casually ignore, but it is also not something to automatically fear without context. It is information, useful information. Information that becomes powerful when you collect it correctly, track it consistently, and connect it to sleep, stress, medication, and evening habits. If this video helped you, share it with a senior who checks blood pressure at home and worries about those early readings. And subscribe, because the more you understand what your body is telling you, the safer and stronger you become. Take care of yourself today, and I will see you in the next video.